Hi there, my name is Lewis Millen, and today this presentation is on cold water immersion and its use in sport. So, what is cold water immersion? Well, looking from the picture on the side, you'd think it was a form of torture method, but it's not. It's a common form of recovery strategy used by athletes all the way from amateur up to elite level athletes. And it's used to reduce exercise stress, which diminishes the body's ability to perform exercise. So used for delayed onset muscle soreness and other areas like this to improve the ability to perform next time. Therefore, it's extremely useful during stressful bouts of training or competition. So what you can see on the right there is John Terry in an ice bath enjoying himself very much. And we're going to talk a little bit about the protocol of how this is done. So as you can see in industry as well as in research, ice baths are usually maintained below 15 degrees Celsius on average. An athlete enters the ice bath immediately after training, spending around 6 to 10 minutes, sometimes up to 15, immersed in the water. And then after that, the athlete then gets warm and dressed to prevent hypothermia. So what are the mechanisms? Well, it's kind of difficult to understand how the mechanisms occur and what causes cold water immersion to be so effective. But these are the basics and these are the ideas which have all been culminated together by McGorm and his colleagues in 2015 to say, well, these are the suggested reasons. So first of all, it's decreased nerve conductivity, increased hydrostatic pressure, decreased core temperature from the water, obviously, and increased vasoconstriction. Now, we'll talk about these more in further detail, but their arguments for these is that they cause muscle soreness to decrease edema from inflammation, which also helps increase muscle function, as well as decreasing core temperature. Skin and muscle will help increase muscle function, and then also this will help with the vasoconstriction, reducing primary and secondary damage. So let's first of all look at nerve velocity by Alagafly and his colleagues in 2007. What they proposed was that nerve conductivity and the velocity of it will decrease due to the reduction in the temperature, and this was being previously discovered years ago in mice and others that temperature decreases it. They believed that this would lead to an inhibition of nociceptors, reduce muscle spasms, and also the reduction of metabolic enzyme activity levels. All of these would lead to an increase in the pain threshold and pain tolerance, which may lead to an increase in performance. Now, what they found was that the nerve conduct velocity was actually significantly reduced as stim temperature was reduced to 10 degrees by a accommodating total of, as you can see here, about 30%. It also led to an increase in pain threshold and pain tolerance at both assessed sites, which were in the legs for this study. It's particularly in the vastus lateralis and also the gastrocnemius. The changes in the pain threshold were up by 89 to 71% and pain tolerance by 76 to 56%, which we can see is a massive difference, which actually has a positive to show that they can go back into performance earlier. So hydrostatic pressure then. Wilcott and colleagues in 2006 had a look at this. In their paper, they discussed it quite thoroughly. And what they were saying is, well, due to the depth of the water, you're actually getting a decrease in gravity because of the water. And so what we need to do is actually increase the amount of effort to pump blood to the extremities, especially down low. So what that causes is an increase in cardiac response due to an increase in stroke volume. So what happens there is more blood flow is pushed, or greater force is pushed down to the feet to remove fatigue and metabolites, therefore suggesting that this may be the reason for a reduction in fatigue that's been identified in many studies. So Ishan and colleagues in 2013 were discussing vasoconstriction, and they looked at the fact that the periphery would be vasoconstricted due to cold water temperature, and they suggested this was a reflexive vasoconstriction, which would contribute to the anti-inflammatory influence of the cold water during recovery. They said this would be a benefit because reducing the blood flow is thought to decrease muscle fiber edema and subsequent pain, functional impairment, and potential for secondary damage caused by inflammation. Muscle fibers with cyclolemma disruption or with increased osmolarity have increased risk of edema, which we find when we have athletes who have had exercise-induced muscle damage. So the idea that by reducing the blood flow, we wouldn't get secondary damage such as leaking calcium ions, or the influence of certain blood vessels, white blood vessels coming in, has been seen as that could be a possible reason for the athletes saying they feel better recovered. Meta-analysis altogether of cold water immersion and identify any acute benefits they could. So what they found overwhelmingly was there was a huge significant difference in the DOMS effect from cold water to the control groups, and it went up to 96 hours in just normal exercise, and there was a decrease in the effect in DOMS related to cold water immersion. They also found this in high intensity of up to 48 hours and eccentric up to 24 hours afterwards, which is also seen as a bonus. However, these weren't as significant as just regular concentric contraction or regular training in football, hockey, and other sports like this. Power was also found to be increased recovery rate of up to 72 hours post the cold water immersion, post exercise with cold water immersion. They also found a small effect on the creatine kinase influx into the blood, finding that it actually decreased it, which is also used as an indirect marker of muscle damage. So we can also see that there is a reduced effect of secondary damage or muscle damage with cold water immersion. However, another study come out 2014, as well as within leaders, found that there is an absolute placebo effect with exercise. So when athletes were given a magic bath, that they said it was actually going to cure them, they would be absolutely fine, found the exact same effects with that as with cold water immersion. So there might be a huge influence with this placebo. But lastly, when we looked at strength recovery, they found there was no effect on strength recovery, and that it was the exact same as control group. So mainly this is more of a endurance-based one, with the placebo of feeling good, so it'd be really good for a short-term recovery if the athlete needed to quickly change and quickly get back into performing again. So as we can see, that acute effects have been widely shown that it's very beneficial. However, chronic effects have only started really to be put into research and actually look at the chronic effects of using cold water immersion on your training. And there's two conflicting theories as to is it beneficial or is it not. So the first one is too much recovery may decrease inflammation and soreness, therefore lessen the trigger for adapting to the training. Theory two is if the athlete is less sore and less fatigued, then potentially they could train with enhanced quality and or quantity. Now, if we look on the right here, we see there's this Goldilocks principle, and what we're actually showing is the stimulus, recovery, fatigue cycle. When you have your training, you are decreased performance because you're fatigued, and then you have an upward spike up to your supercompensation where you're performing at your best. What may happen is that if you have too much recovery, you may never actually get that increase in performance. And if that inflammation and that soreness is actually causing you to trigger and actually adapt to training, if we're diminishing that with cold water immersion, that could be detrimental to our actual ability to get that peak effect in performance, as you can see. Whereas theory two is suggesting that actually we're decreasing that fatigue cycle, so we're actually going to have a supercompensation and we're going to get back into performing quicker, and so we're going to just carry on going up. So let's have a look at theory one evidence first then. So Frolic and colleagues in 2014 analysed the effects of repeated cold water immersion after training sessions on the adaptations to strength training, which was a 9-week strength training program. Testing was completed every 3 weeks, and directly after each training session, cold water was applied to a single leg, and then the other leg was chosen as the control. A significant increase in 1 rep max and 12 rep max from baseline to test 2 and to test 3, respectively, were found for both cold water and for the control group. The control leg, sorry. The percentage change difference between both conditions were 1.6% for the increase in 1 rep max from test 1 to test 2 and 2% from test 2 to test 3 in favour of the controlled leg. So what this identified was that long-term strength training adaptations in trained subjects can be negatively impacted by the cold water immersion. However, they were quite small percentage changes, and the practical relevance had to be considered by the practitioners and the athlete themselves before realistically saying that actually this 1% makes a massive difference. Now, this could be a big difference for certain sports like power, but when it comes to football or other sports, maybe intermittent team sports, would a 1% be necessarily the worst thing? So these are all considerations that need to be done before actually evaluating and saying this is a bad thing. So also in Theory 1 evidence is Yamain and colleagues 2015. So their study looked at the effects of regular post-exercise cold application on muscular and vascular adaptations induced by moderate intensity resistant training. So this was 5 sets of 8 wrist flexion exercises at a workload of around 70 to 80% of their 1 rep max, and this was done 3 sessions a week for 6 weeks, and the cold water was 10 degrees plus or minus 1 for 20 minutes after wrist flexion exercises. Now this is 20 minutes is a little bit longer than your average session in the cold water, and 10 degrees is about average for cold water. So what was noticed was that wrist flexor thickness of the experimental arms increased in both groups, but the extent was significantly less in the cold water comparatively to the control arm. Maximum muscle strength and brachial artery diameter did not increase in the cold water immersion, but increased in the control group. Local muscle endurance increased in both groups, but increased in the cold water immersion was lower, but wasn't significant. So they hypothesized that regular cold water immersion to the muscles might attenuate muscle and vascular adaptations to resistance training. So they've identified that their muscular strength and the brachial diameter was actually larger in the cold water. So the main findings of these evidence is that to strength, cold water is not beneficial. Roberts and colleagues in 2015, they compared cold water immersion and the active recovery on changes in strength after 12 weeks of training and on specific signaling pathways that triggered muscular growth. What they found was that cold water immersion decreased gains in muscle mass and strength and blunted key proteins responsible for the muscle growth. Particularly, they found that satellite cells in the muscle were actually smaller in cold water immersion than they were in the control groups or other active recovery groups. And so they said that actually we need to realize that in terms of use for strength athletes or power athletes, cold water immersion is maybe not the best idea if that's their goals and that's their aims. But again, the subjects in the study were not elite and were only trained twice per week. So there was a suggestion that maybe if they increased it to 3 times a week, then the percentages would go back to being similar or non-statistically significant. So let's go on to theory 2 then, that the fact that it is actually beneficial. So Howson and colleagues in 2014 did 4 cold water sessions per week or a passive recovery instead, over 7 days of baseline training, 21 days of intense training, and 11 tapered in highly trained cyclists in Australia, I believe. What they did was between the baseline and the taper, cyclists in the cold water group had an unclear change in overall 4-minute power relative to the control group. So it was about 2.7 plus or minus 5.7% higher. And the mean the mean power in the second effort relative to the first was likely higher for the cold water immersion group relative to the cold. Again, 3% higher, plus or minus 3.8%, so that 95% makes it unsure. The changes in the 1 second maximal mean sprint power in the cold water group was likely beneficial comparatively with the control group. It was 4.4 plus or minus 4.2%. 0.2%, is it the smallest worthwhile change or isn't it? And they found that differences between the groups for the 10-minute time trial were unclear. So it was minus 0.4 average mean value for the cold water immersion was faster, plus or minus 4.3. So again, unclear if there was. So the evidence suggested that even if there wasn't an increase in performance, there was definitely no difference in performance from a chronic exposure to cold water immersion. So Isham and colleagues in 2015 investigated the effect of regular post-exercise and cold water immersion on muscle aerobic adaptations to endurance training. and this was done with 3 sessions per week of endurance training for 4 weeks. Following each session, subjects immersed one leg in the cold water bath, 10 degrees, for 15 minutes, and the other leg was the control group. Muscle biopsies were obtained from the vastus lateralis prior to training and 48 hours following the last training session to look at the effects of cold water immersion and muscle aerobic adaptations. So for both groups, peak oxygen uptake and running velocity improved, 5.9% and 6.2%, and repeated cold water immersion resulted in higher total AMPK and other protein pathways. Now, AMPK is responsible for, say, master regulator in the cell, but it's also majorly responsible for ATP levels and homeostasis in the cell itself. So it's become quite crucial when you're doing endurance training to have quite a lot of ATP for the energy. So having more of them obviously is very beneficial. Moreover, large effect sizes in cold water immersion for changes in protein content of P38 and PGC1 alpha, as well as peroxisome proliferator activating receptor alpha, indicated that regular cold water immersion enhances these areas and possibly mitochondrial biogenesis. Obviously, more mitochondria is incredibly beneficial for producing high levels of ATP and energy to carry on the movement in the muscle. So, are there positive chronic effects? Because what we're seeing is very conflicting research suggesting, well, no and yes. But the recent research suggested that there is an attenuated effect on muscular strength, and so regular or chronic effects of cold water immersion may diminish that, but there's also a suggestion that a positive effect on endurance capacity. So for those that are more inclined to endurance, it may be beneficial. Those that want strength, maybe having it only when during competition or for fast recovery may be the better idea. So the question is, should cold water immersion be used for recovery in sport? Well, the acute benefits are well documented. The chronic effects obviously are difficult to fully understand, and more research is necessary because the research is only 5 years old, majoritively. Therefore, when considering the use of cold water immersion, it is important to say performance goal orientation is the key factor. So Halson, a scientist at the Australian Institute of Sport, on a blog post, she wrote that instead of thinking that cold water immersion shouldn't be used in a chronic and shouldn't be used at all, she decided that actually may be better having a performance goal checklist. So if your goals are short term, as the list below, for example, are your competition days frequent, these short goals may actually mean that cold water immersion may be very beneficial. For example, if you're in a hot temperature, having a cold water bath or cold water immersion may be beneficial just to cool you down. It's also found that it actually helps your sleep and etc., things like that. So it may be very, very beneficial for an athlete who's chronically worried or things like this. But maybe if these ideas, which are short term, aren't necessary, and actually you're looking at long term, then cold water immersion may not be beneficial. And I think what she's picked up and is very good is that you need to realize what the goals is of your athlete and what your organization goals are before saying that no, this is a very bad idea for a recovery strategy. Thanks for watching. These are the references.